Hello everybody, thank you for joining me on this series of videos. My name is Dr. Bill Owens. A little background on me, I'm an adjunct professor at University of Bridgeport College of Chiropractic and also assistant adjunct professor at University of Buffalo School of Medicine and Biomedical Sciences. And that's a unique situation because what we're going to talk about a little bit today is how to bring the chiropractic and the medical professions together and not necessarily to change either one of those professions or to deviate from the philosophy that we have as chiropractors, but more to educate each other and find common ground where we can work together for a mutual benefit, but also be able to help a lot more patients in the process. So what I wanted to talk about in this series is a presentation that I had the ability to present in front of the University of Buffalo Family Medicine Department. Now this was really about answering their questions and concerns on how chiropractic fits into the healthcare model. And what's interesting is, and you'll hear me say this over and over again, that what's interesting is when we get rid of all the smoke and mirrors, the fundamental process of building this relationship is about building trust and personal relationships and educating the family practice doctors in particular on where chiropractic fits in and how to basically use us with patients. So the title of this presentation was Chiropractic Management as a Portal of Entry for Spine Care in the Primary Care Setting. So what the foundation of this talk is that, you know, historically, you probably know as well as I do that we tend, as chiropractors, tend to get patients more often at the end of care. You know, we don't know what to do with them anymore. They're not responding to anything else, so maybe try chiropractic. And we know that although that can be successful in the majority of the time, we're much more efficient when we get people at the beginning of their problem. So the idea behind this is that, you know, when there is a spinal problem, that the chiropractor in the conservative realm, meaning non-surgical and non-pharmacological pain management, would really sort of quarterback what's going on with the patient. Now, the first thing I will say is that your credentials and your postgraduate education, your ability to interpret MRIs and your ability to report properly are fundamental to this process even beginning to start for you. And one of the things that I do personally with doctors on the consulting side is lay that infrastructure and that foundation so that we can take you to the next level and build these relationships. So the first pillar of this presentation was really to identify a problem. And the problem that's being recognized at the medical schools, especially the one that I work with, is the overuse and abuse and overprescription of opioid pain relievers. And this article came out from the Center for Disease Control. This is their monthly report, Morbidity and Mortality Weekly, or actually weekly report, not monthly, but it's called Vital Signs. And the title of this was Overdoses of Prescription Opioid Pain Relievers. Now, we know that musculoskeletal problems, spinal problems are a major reason a patient would come to a doctor's office, a family doctor's office. And all of these things are being thrown at the patient. We have chiropractic, we have physical therapy, we have acupuncture, we have health and nutrition and fitness and exercise, we have over-the-counter medications, we have prescription medications, we have narcotic medications, we have pain management specialists. There's so many options and everybody is looking at this problem, but fundamentally, it's still getting worse. And every time a solution comes up, like the opioid pain relievers, it seems to create another problem. And if that was working, we would be seeing less and less of this, but we're seeing more and more. And the one caveat of this whole situation is that chiropractic is still underutilized. And from what we see in our clinics and what I'm teaching to the medical schools is that increasing utilization of chiropractic early on in care will have a profound influence on this problem. So what this article said and talked about was sales of opioid pain relievers. So those are your hydrocodones, your Vicodins, etc. Sales of opioid prescription or pain relievers quadrupled between 1999 and 2010. If you practice and you're not living under a rock, you see that every day in your office. Now, this was the one thing that I think sort of grabbed me and said, hey, we can offer a solution to this as chiropractors. Enough opioid pain relievers were prescribed last year, and that meant in 2010, to medicate every American adult with a standard pain treatment dose of 5 milligrams of hydrocodone taken every 4 hours for a month. Okay, so enough opioids were prescribed in the United States to give every single adult enough medication to take a pill every 4 hours for 30 days. That is a huge amount of patients. And if you look at the percentage of people that should be prescribed that medication, okay, because remember, when you're using this level of pain relievers, it's not musculoskeletal care that was really designed for. It was designed to treat people with malignant pain and really serious central nervous system pain syndromes over the long term, not for conditions that can be resolved with other means. So abuse of opioid pain relievers costs health insurers approximately $72.5 billion annually. So the medication costs and surgical costs are the two biggest reasons that costs are escalating. So really, where do we stand and where can chiropractic help with this? Chiropractic can help by managing these patients better at the beginning, because see, just like failed back syndrome, failed back surgery syndrome, and just like the same situation with the opioid pain relievers, if we can reduce the amount of patients that enter that phase of care, the end result of that is going to be better management and less need for opioid pain relievers and less abuse. So if you remember in one of the last YouTube videos, I talked about the role of spinal manipulation in reducing pain. That is a hallmark of this presentation. And what we do is we take this presentation and it is part of our continuing medical education program. So what you want to do is, in a stepwise fashion, and this is what I teach, and this is what I do in my practices, and this is what's working in our area in Buffalo, is we get you to a point where on your curriculum vitae you're taken seriously. And that's important. Second is we reach out to the medical community in your area and position you as the doctor that's leading this research, that's taking this research and implementing it into daily practice and offering a solution that's not being offered anywhere else. And then third, we take these presentations and we put you into medical offices and situations where that you can teach these and offer continuing medical education credits. So in just wrapping up here, the benefit of doing that is a few continuing medical education lunches or breakfasts sprinkled throughout the year has greater impact for you and your practice than any amount of advertising or any number of health fairs that you could ever possibly do. And you will see that even at the first one that you do. And it's okay if you don't like to speak in front of people, that's fine. I've done these across the table one-on-one, and you will get better as you go. So we got to the point of me doing this in Buffalo that we're actually having a joint meeting between the local Family Practice Medical Association and the local Chiropractic Association, because we both realize that if we work better together, everybody will do better together, we will have better outcomes with patients, and our offices will all be full. So if you have questions on this, I know it's a lot, and if you haven't been doing this type of outreach, it can seem a little daunting. So I have all these presentations together. I work with hundreds of doctors on a weekly basis all across the country, and I can really help you outline a plan. So my email address is right at the bottom. If you feel like you want to call me, but the best way is through my email, and I'd be happy to help you in whatever area you're having trouble and whatever area we need to insert you in to raise you to the next level. So thank you very much for taking the time to listen to this presentation, and I look forward to hearing from you. Thank you.